Hello, everyone. I'm Dr. Van Merkel, and I'd like to share some things with you over the next few minutes. Now, the first thing you see here is we are still slammed with new nutrition patients. I talked to my staff just yesterday, and that's what she told me. Now, we did some special marketing in May of June during the quarantine, during the pandemic, and it rocked. It really did great things for our practice. We saw a ton of new patients, and it is still going on 2, 3, 4 months later. It's that effective. And I'm going to share exactly what we did at the end of this presentation. The presentation won't be any longer than about 10 minutes. So hang in there. Got some great information, some things I want you to think about. But are you prepared for the next pandemic? It's coming sooner than you think. Dr. Fauci has said basically the pandemic rages on and there's essentially no end in sight. The CDC says the fall and winter of 2020 and 20 are expected to be probably one of the most difficult times we have experienced. So you think last winter was bad? They're expecting this year to be even worse. Wow. In most places where it had quarantine for 2 months, some are still going on. What's going to happen to your business if you get shut down where people can't come in to see you? So how'd your business do during the COVID quarantine? My practice in Dayton, Ohio maintained 76% of our business in April, May, and June of what we did in 2019. 76%. That's pretty good because I know a lot of businesses were crashing and there were even a lot of chiropractic clinics that had their doors closed. Now, we did a special marketing program, like I just mentioned, in June and July of this year. We're higher in services than 2019. Wow, wouldn't that blow your mind? And it's still carrying on through into August. Now, it's just September 15th. We did better in August this year than last year. Pretty amazing, isn't it? But that's the benefit of science-based nutrition, what I'm presenting today. So, could your practice survive another shutdown? 90% of my practice does not require a physical presence by the patient. Start now. Start now. And prepare for the next pandemic. Don't wait till it hits. And we all know that with the pandemic, people are hesitant to travel to a doctor's office. Even now, they're hesitant to come in. And so with telenutrition, it is possible, and SBN members have been using it for years. 4 years. And I know members that breezed right through the COVID-19 pandemic, even better than what my clinic did. And we did very well. So, it's not necessary to see the patient provide much needed nutritional health care. Patients need this more than ever, and they're looking for it. They were desperate for it during this COVID crisis. In fact, during any time, they're truly looking for the work that I'm showing you, but is even more significant during the quarantine. So why should you use telenutrition? Healthy people don't die from COVID. There are vitamins that are known to be a benefit for patients to survive and avoid COVID-19. Laboratory testing can easily identify other deficiencies, imbalances, toxicities, organ dysfunction that can weaken the immune system. Testing through SBN is easy and inexpensive, truly, and people will pay out of pocket for it. I've had a cash practice for over almost 30 years. And my clinic in Dayton, Ohio last year did $1.7 million, about 1,730,000, something like that. All cash, 100% cash. And SBN members have been using it for years, and many maintained a high level of function. So why use SBN, the cloud-based solution for telenutrition? First of all, SBN provides all the tools you need. It's all right here. It's a platform to run your business and do teleconsultations and report of findings. Ongoing online training. It's available 24/7. The SBN support team is ready to help you and assist you in providing SBN to your patients and community. We have a complete system including patient management and office management. We have extensive marketing that really works and is available. SBN's most important tool is the patented report. It is the computer system is the most advanced, state-of-the-art, color-coded reporting system. The announced recommendations are comprehensive. It integrates a patient symptom survey, medications, side effects of meds, nutrient depletions caused by those meds, special considerations, actual lab results of blood, hair, urine, etc., medication-inducing lab findings, specific vitamin, nutrient, and dietary recommendations, and much more. Objectivity results are easy to see, and report is easy to understand. After this presentation, you'll be able to watch a little short video on everything, all the uniqueness, the benefits, the beauty of the science-based nutrition report. Truly, it's the single most important thing that I developed, and it really does help promote the practice, the business, helps promote marketing, helps patient compliance. People now know exactly what they're doing and why they're doing it. They expect to see results. It's going to drive compliance. It's going to drive vitamins. It's going to drive retesting. Watch the video after this presentation. And the report is so easy to understand. By far, the best ever. So, science-based nutrition, telenutrition, proven system. Proven results with even serious conditions on thousands of patients. In fact, if you'll listen to the SBN member testimonials, you'll be blown away by the results. They get not just me. I've gotten great results for many, many years, over 30 years. Now, SBN trained doctors are getting results just like I do. That's phenomenal. And it's established for many years, and it's all cloud-based. More advantages, experience and proven results, experience and backup for your tough case. You're not out there on your own. When you're an SBN member, we're here to help you. We're not here to run your practice. We're here to guide you, especially when you get those tough cases. We also have the best discounts on lab testing through LabCorp, Quest, and Doctors Data. Truly, you're not going to find any better discount lab testing than what we have, and there's a lot of benefits to doing it through SBN. It's going to reduce your data entry dramatically and other benefits. And you have a high level of practice with all of our technology we have. It's going to result in you're going to need less staff. So you don't need to have a lot of staff to have a high level or high perceived level of business with SBN. And we have continued office and processing support and training for doctors and staff, and as always, the technical support for those tough cases. Caution, science-based nutrition will not work for you unless you get busy and get trained. Go through the process, get yourself tested first. It's hard to promote what you haven't done yourself, so get tested and show people your test results. Watch SBN member testimonial videos, read each report thoroughly. You're going to learn everything you need to know about the patients, the labs, and your patient's everything they need to know is written down in that report. So read each report thoroughly. Do the recommended marketing with your current patients first. We've got all kinds of marketing, social media marketing, etc. Now, proven benefit with science-based nutrition. Some SBN members do SBN just a few hours a week, just do telenutrition a few hours a week. They bring an extra $50K profit a year. That's nice. It's okay. It's like a supplemental retirement income. Not bad. Work a few hours a week, make a few bucks. That's a nice thing. Some SBN members are well over 200 grand profit. Well over, a few are even higher than that. The more you work and follow the guidelines and training, the more successful you will be. Period. The harder you work, the luckier you're going to get, the more opportunities are going to come, the more you're going to do. SBN is already proven. We've got hundreds of doctors, thousands of patients that show this works. You just have to use it. So what are you waiting for? The next pandemic? For your practice to be shut down? Get started now. So the special marketing we did during the quarantine, what did we do? I'm still excited about my staff. Here's what happened. I go downstairs, my staff says, our printer broke. I said, you knew our new printer we bought just a few months ago? They said, yeah, it's broken. I said, it should still be under warranty. They looked at me and says, with all the patients we've been seeing, the printer had a warranty limit of 30,000 pages. She said, we're way past that. What a terrible problem to have. Our printer, even though I'm sad that it is no longer working, we got to get it repaired or buy a new one, I'm glad that we wore it out. Isn't that a great thing? You wear it out. So here's a marketing campaign we did. Major marketing campaign. We ran some radio commercials. Here's my thought back in when this first started happening in March, April. I was thinking, something, people are at home, they're scared, they're not working, maybe their finances are a little bit tenuous. I said, how about if we share some of that burden too? Really, that's what I thought. Why don't we share some of the burden and show that we're willing to do what we can to help our community and the patients to get through this crisis together. And so I have 3 associate doctors, 3 team doctors here, and we all agreed to reduce our consultations, our report of findings, our office visits by 50%. Now, understand, this was not a discount. We're not playing that discount game. We actually reduced our fees for 2 months by 50%. Everybody got reduced fees by 50%. Now, that included adjustments and acupuncture when things eased up and people could get in or there were crisis situations. But all of our consultations, office visits, report of findings, etc., were 50% reduced for those 2 months. We could not reduce our vitamins and lab fees. Obviously, they were already at low rates. We'd been directly losing money. But because people knew that we were willing to reduce our profit and maybe make no profit during those 2 months, we had tons of people come in. Because y'all want to know where they're at. We marketed that with testing. You can see how your immune system is doing. They had heard that vitamin D is extremely beneficial to resist COVID and to have a good outcome if you do get it. So people want their vitamin D test. We could do other testing, check their liver, their kidneys, check their CBC, are they anemic? And so many things that we could test, and we just told people for $600, you can really see where you're at and see what you need to do and help to build your immune system to resist the COVID if you get exposed to it or to get over it if you do get it. And that worked like crazy. Our staff said the phone were ringing off the hook, and so we did it all long distance. We did long distance phone consults. My staff then did eRex, which you're going to learn with the coming videos that you can log into. With eRex and everything done online, we're able to provide our nutritional service completely without the patient ever stepping into our office. And when the patient needed vitamins, we could either mail them right off or they could drive to our office and our staff would take them out to their car. It worked great. In fact, we're still doing that. Now, we had already been doing telenutrition in my practice for 25 years, 30 years. But with this COVID quarantine, it was perfect because our system was already set up for it, and we have a system for you that will work just as well. But you got to have the system, you got to have the tools, you got to have the computer programs, and SBN is already up and running. We are the leader in telenutrition. And I encourage you to get started right away. So the next step, watch the SBN sample report explanation video. Watch the video on other tools like eRex and our ticket system, etc. Next, become an SBN member as soon as possible. Don't wait till crisis hits and the sky falls. Get going now. And or you might think, no, I think I'll wait till the next pandemic and my practice totally crashes and I'm in the depths of despair and poverty. Then I think I'll do it. No, I actually had doctors say, I knew about SBN for years. I wish I would have done it. In fact, I wish I had it ready now because I need it. Well, we can get you up and running quick, but it'd be better if you prepare now because you know something? The nutritional work I'm talking about, your patients need that now. Whether they're worried about the COVID or the pandemic, they actually need lab tested now. And I'm telling people all the time, even right now, which is why I believe they're still saying that we're killing it with so many new patients, because I'm still telling everybody fall's coming. They're predicting the worst COVID ever, the worst pandemic ever, worse than 19. So get tested now. Don't wait. And that's why people are coming in. Are you the same way? Are you preparing your practice and letting your patients know that you can help them for the coming pandemic? Don't wait. Get signed up. If you think you wait till you're ready, if you wait till you think you're ready, you will wait forever, and you'll always have regret and always wonder why. Why did my practice never take off? It's because you have got to take action. So right there's your next steps. Thank you for listening. Hope you become an SBN member and help your patients get through the next pandemic. Thanks for listening. I'm Dr. Merkel.